to some needs in some communities, but not others. So I was really surprised at how diverse the facilities are and how different the core services that each and every one provides to each community is different. So I mean, I think that's kind of the fundamental piece of the bill, is really that community engagement to determine not only what services may be discontinued, but I think more importantly, what the vision of the facility should be and what kinds of services they can provide in the future. You know, the second portion of the bill really deals with how can we attract external capital. We all know that state funding is limited and the cost of healthcare is really skyrocketing on all kinds of fronts. So what kinds of different structures and public and private partnerships can we create that will allow an infusion of private capital into the system? And the bill does provide a provision that allows a region or a facility to transition into a new kind of entity, whether it be a separate corporation or it be a public-private partnership, but really that would allow investment of external capital to pursue or make investments in new services. I think that this is fundamentally important, especially for our acute care hospitals. And clearly, you know, Maui has been spending a whole lot of time looking at different kinds of partners, but I really do see this as an opportunity in the future for a Hilo Medical Center or a Kona or any, even of the long-term care facilities. I really do think that public-private partnerships will be critical to providing expansion capital and really looking for that opportunity to offer new and enhanced services for the health systems.
And I think the key, David, too, is that each in their own time, right? I mean, each individual region and the facilities themselves really have to come to that decision themselves, working with the community. So it's really providing them with the tools going forward.
Right. I mean, I do think, and it's very important to understand that each of these elements are really enabling and really, as you said, is really just providing the tools. Some regions or facilities may be more prepared to pursue it. And you know, there may be other solutions. As I've learned about the facilities, they're so different, even though they serve rural communities. I'm certain that each solution that we find, whether it be for Hilo or Kona or Kohala, will be different than a solution that we might find on Kauai or on Maui or on Oahu. So the bill does provide a lot of flexibility for creating new kinds of partnerships that we probably can't even think of today.
Because for perspective, I guess, for our viewers, just to kind of support and illustrate that point, Maui only has one hospital. And it makes it very challenging for them because any services you're going to get them at that facility. So their need to partner with someone who wants to bring in a new wing or a new facility could be very valuable. Whereas Big Island, we are lucky to have a big hospital in each region, in Kona and Hilo, and also smaller hospitals in Hamakua, Ka'u, and Kohala. So the road that Big Island goes down may be very different from the road that Maui goes down. And that's why when Chairman uses the word enabling, it really means that. It enables them to pursue what road is best for them. And I think maybe I'll beg the question also, what do we do in the interim until they make that change? Well, a lot of attention has been spent on what kind of resources are necessary for these 2 years during this recession to make sure that no hospital closes, and no hospital is going to close on Big Island or elsewhere, as far as I'm concerned, in the system. So leadership with Senator Kokubun and Senator Hanabusa and the Ways and Means Committee came up with a large package through the Health Committee to make sure that there was adequate monies to keep the hospitals going, to have time to make these transitions. So, Chair, maybe you can explain to them.
I do think, you know, and this clearly, I think, was the most difficult session from a financial perspective that I've ever been involved with. Clearly, the newspaper has talked about the fact that the Council of Revenue's projected revenue forecast from the time that we started our conversations about Hawaii hospitals, health systems in October and November to when we concluded, more than $2 billion disappeared from the budget. In a state where the annual operating funds is $5 billion, that's a pretty significant amount of money. So clearly the legislature made a statement that the Hawaii Health Systems Corporation was a very, very important entity in the state. You know, we had, through various appropriations, first we appropriated $14 million in an emergency appropriation that would go to several of the facilities to really pay down the accounts payable. And as you know, anybody involved with a hospital knows that that's really the big trigger point that, you know, threatens to shut down the facility. I mean, if vendors suddenly are asking for cash-only basis and are not willing to provide you supplies or needs, clearly the hospital cannot operate or facility cannot operate. So that emergency appropriation was kind of the first a solution to try and support the hospitals. I think more importantly, in the base budget, we did a couple things. You know, we did appropriate, you know, another $25 million in general funds that would go to provide increased subsidy to the corporation. And that's in addition to the executive budget, which already included $82 million in general funds. And more importantly, that $25 million in additional funds would result in another $20 million or $25 million more in federal funds. So in total, the legislature provided another almost $60 million for the corporation. And, you know, I think from the legislative perspective, you know, we really wanted we wanted the CEOs and the regions to be able to contemplate what their future looks like and what the corporation looks like 2 years from now without worrying about making payroll every week or paying vendors or being on the verge of a shutdown. You know, our work on the budget was really to establish a sound foundation so that the regions and the CEOs can really begin to think about how do I engage the community, how do I engage the staff.